I'm going to explain cancer in a layman's way, so for general public to understand. For every living organism, it has time for growth, it has time to die. So there's a relationship between growth and death. So when you have a cells that refuse to die, continue to grow indefinitely, that cells or tissues have properties of cancer. So we can now define cancer in this way, that cancer is progressive growth of cells that has no purpose or function to the tissue or to the body. Rather, it takes away from the body. Well, the cause of cancer is multifactorial. When we say multifactorial, is that many things cause cancer. It can be genetic, it can be spontaneous. Genetic, it means that a patient inherited some defective gene from the parents. So, and that is now expressed later in life as cancer. Then that one is about 10 to 15%. Then the other one is now the one that occurs spontaneously, in which that's for a patient that doesn't have any risk factor of any type, then suddenly develop this cancer. So and that one is very common, and that's what we see most often in the clinic. I give example of a woman that developed lung cancer. We saw her in the clinic, and we were able to do what we call the medical history and examined every information, valuable information, and found that she doesn't smoke, no family history of cancer of any type. She doesn't live in a polluted environment. She's just a teacher, and she doesn't drink. So, and we are now wondering what must have caused the cancer of the lung. So, at the end of the day, we found out that not just a spontaneous growth, because there in the lung, there's that same process of growth and death of cells. So sometimes when the cells refuse to die, become immortal, they progress to cancer. So at that point, the body checkpoints that normally remove some of these radicals that cause cancer, maybe they were not functional or defective at that point. So they could not detect some of these abnormal cells, which now continue to grow. So in terms of certain things you may be doing that may really be preventive or modify the likelihood of developing this, there are as well as many. And that has to do with some of the known risk factors by trying to do certain things that are going to reduce the risk of developing that. And we take some examples, like breast cancer is more common in those who are nulliparous. Nulliparous, those who have not had babies and they have not had any pregnancy, full-term pregnancy. They are single, they are not married, or they have not carried baby in any form or be pregnant in any form before. Then those who are obese, those who are on oral contraceptives, and those who have been exposed to radiation, maybe to the chest, maybe when they are small or something like that. So when we are looking at those things, or those who have a kind of a BRCA risk factor, so some of those things is that they can be reduced or they can be modified by, first, if a woman is able to carry baby to term, breastfeed the baby, it reduces the incidence of developing breast cancer. If she's obese and able to reduce her weight by doing exercise, good dietary control, she can reduce that. So it has been on oral contraceptives and able to quit and do a kind of follow-up for some times, we can reduce that. So you can see that we are able to modify some of those things. We now have chances of reducing the risk of developing cancer. So for those who smoke, who are usually prone to head and neck cancers, if you're able to quit smoking or you don't smoke at all, so the chances of developing that is developing cancer is now being reduced. So those are the lifestyle modifications that there are many, there are thousands of them that you can embark on then the risk of developing cancer is now reduced. But that does not take away the fact that cancer can develop spontaneously for those who are equally doing that. But it increases the lifestyle modification, increases the chance of not developing that. And you can only get that information if you're able to listen to some of this cancer awareness campaign and able to do regular health check and screening and develop what we call health-seeking behavior, so that anytime you have feeling that is not normal, then you see your doctor as quickly as possible. That may be a cancer in evolution and you may not know. So it's good for your doctor to screen you and able to give you some assurance that nothing is going wrong. Yes, cancer is curable, but there's a caveat. The caveat is that you must report early. Early detected cancer is curable in any part of the world. And so much have gone into research in terms of some of the necessary equipment to detect this cancer. It now left for individual government and societies to acquire some of these machines and able to develop better health-seeking behavior so that early screening and detection will be done. And once we have that, I'll show you, cancer is curable. And one of the things that are making people to look at cancer that is not curable is that we have poor information management system. We do not have a strong functional information system in terms of disseminating this cancer awareness campaign down to the rural areas. Some of these things we are doing, you see now we are here in Abuja, then I don't think the people in my village have seen this kind of thing for the past 5 years. If somebody does not go there to talk to them. So if we are able to trickle this down to the village, we'll see that we are going to have more success story than what we're seeing today. What makes people to look at cancer that's not curable is that people presenting very late. When you present with a locally advanced disease or metastatic disease that has spread, cancer is no longer curable but manageable. So there's difference between being managed and being cured. Any patient that presents very early, which is usually by detection, like a woman who is taking a bath or doing breast self-examination and detect a lump and able to rush to the hospital as early as possible. In such cases, we normally have a good result. But a woman that refuses to go to hospital, start going to prayer house, start going to babalawo, start going to one place or the other, and the disease is progressing. When the breast have already developed wound or ulcer, then she now run to hospital because that time she's now having pain. Because most of them they are waiting for them to have pain. They say, I have a lump in the breast, but it's not paining me. But he doesn't know that that is a sign of cancer. So when she presents with that at that stage, at that point, the disease already spread or gone far into the body. So at the end of the day, when the patient died, they will now be saying that she even went to hospital, but they could not do anything. The reason is that she didn't present early. So and once a cancer did not present early, it's a big challenge to the physicians and to the patient. So cancer, I would say, is curable, and the science has improved so much that for now we have machines that can detect cancer, detect the extent of disease, and do a kind of follow-up. We have early stage disease. We talk of surgery, because once you cut off cancer from the body, there's nothing else. It's early stage, so you cut it off and the job is done. Then for some disease that have gone a little bit further, we may use radiotherapy, the one we are doing in National Hospital. So we may use radiotherapy. Sometimes the surgery and radiotherapy are combined together. For early disease, like a patient that has breast lump, we can do lumpectomy. The surgeons can remove the lump and do radiotherapy, and that is done. The patient doesn't need chemotherapy. For those who present with the locally advanced disease, they may now need chemotherapy, in which the disease is now downstaged. It reduced to size, then they go through surgery, and then further is radiotherapy. So we have radiotherapy, we have chemotherapy, we have surgery, then we have watchful waiting. or active surveillance. Those treatment modalities are available here in Nigeria, and it's available here in National Hospital. So we do that, and we have good results. Like what we have here in National Hospital, we have a linear accelerator. We have 2 of them, and they are 3D conformal radiotherapy. So in which we treat to that standard you see in overseas, and most of the side effects that you normally see in the radiotherapy, patients don't see them. And because this is a very big center where we have a multidisciplinary group of doctors working together, we achieve results at all time. So it's been a fantastic outcome working here. What we face most often is that we have cases of patients presenting very late. It bothers us because we are human. It bothers us because sometimes we find out that some of these patients may try to do our best, but we see that the patient may not actually live, and that equally tend to create wrong signals to the public that even though the patient went to the hospital, that he or she did not make it. So patient presenting late is a very big challenge to us as well. Then the number of patients we see, because I told you that this is a referral center, so it's catering for a large number of patients. So there's a huge number of patients that are here. Then in terms of manpower, we are few. Those who are experts in this radiation oncology are few. So we equally faced with the number of the staff that are involved in taking care of the patient. So strengthening the staffs are equally very important, and which the government is doing well, and the hospital is equally recruiting more staffs for us. So recently they were able to push some staffs for us, and you can see the work is going on there. Both the 2 machines are working, and the doctors are around, and the staffs are there. So staff strength is equally a big challenge. Then we now talk about not having some of the key machines that we are asking for, or which Nigerians normally travel to overseas to access, like what we call PET-CT scan, positron emission tomography, computed tomography. It's a machine that we need to use to detect cancer, if there's any residual disease, the extent of the disease, and to follow up the disease, disease progression. So most patients we see here, sometimes after treating them, you may not actually know whether the patient has been completely cured. So you need this machine so that enable you to follow the patient up and see there's no remnant of cancer in the body. And you see, most of the medical tourism that Nigerians experience is because of a lot of people want to access this machine. So if we're able to have it, we have a bunker already here in National Hospital. So it's now left for government to bring that. Knowing full well that it's very important and critical for cancer care in Nigeria, they would like to have it. And already I heard that government is making effort because of some of the budget they made this year to make effort to acquire that machine. So once they acquire that, it will going to change the narrative of cancer treatment in Nigeria as a whole, because nobody would like to enter plane again and travel to anywhere. Already we have what it takes to treat. Now it's what we are now used to know the extent of the disease, right? Which most people, those who have the wherewithal, that normally run to overseas to do it. Either they go to Dubai, South Africa, India, or Egypt, and rest of them, or UK. But once we have it, we can say goodbye to all those countries.